Morning everybody, and welcome to Healthwatch Norfolk's 2025 AGM. Thank you for all of you coming in today. Our agenda today will see us sign and approve the minutes of last year's AGM, update you on our work over the past 12 months, and update you on our financial position. And we'll also be reflecting on our work on our future as the health and social care structure continues to evolve. Firstly, can I ask for any apologies for absence?
We have apologies from Chris MacDonald, David Trevanian, Mark Burgess and Ian Wake.
Thank you very much. And can I now ask for the minutes of the 2024 AGM to be proposed and seconded? Can I have a proposer? Thank you very much, Elaine. And somebody who would like to second the minutes be accepted? Thank you very much indeed, Linda. So I will duly sign those minutes in due course. Thank you. So, moving on to looking back at the last year. How busy have we been in the last year? Well, the numbers speak for themselves. Almost 5,300 people shared their health and social care experiences with us. Almost 200 people came to us for advice and information on a range of topics, including how to get an emergency dental appointment or how to find a new GP practice. We published 40 reports about the improvements people would like to see, and we carried out 260 engagement events. Over the past year, we've done a lot of work to engage with new communities. We've talked to around 4,000 Year 6 students about their health and social care experiences through Norfolk Fire and Rescue Service's Crucial Crew programme. They told us they wanted shorter waiting times, brighter waiting areas, and to be spoken to in a way they understand. We'll publish a full report on this once all the reports have been analysed. Over in the west of the county, we also engaged with hundreds of under-25s as we helped to set up a youth council for the Queen Elizabeth Hospital in King's Lynn. The first 10 members are now in place, with more to be recruited in the autumn. And they're already having an impact around giving feedback on the proposed new hospital and exploring a buddying system for new staff. Our team have also been working on a programme of engagement in care homes, talking to residents, their families and their friends. Each time, the care home received a full report, and managers have been able to both see positive feedback to share and enhance care, as well as put in improvements, including, for example, the introduction of individual buzzers instead of bells for residents, and allowing those who are able to get their own breakfast to do so. Demonstrating the impact that we have to help health and social care improve things is also vital. Our annual report, which is also out today, highlights a number of these, including efforts to improve access to emergency dental appointments via the 111 service, better signing for people using the Community Diagnostic Centre in Great Yarmouth, and ensuring the views of carers are at the core of care, which is happening through the All Ages Carers strategy. These are just 3 examples of ways people have shared their views with us, and we have helped to influence change and improvements in care. You can see more about the work we've done and our achievements later in the meeting. Can I also thank all those who've helped us, our hard-working team of staff and volunteers who gather, analyse and report back on all the experiences people share with us. Those within the ever-changing structures of health and social care who listen and act, we hope, on what we tell them. Most importantly of all, we could not do this work without the hundreds of people who take the time to share their feedback with us. While we cannot necessarily act on every single piece of feedback that we receive, this helps us draw an accurate picture of the care given so that we can tell key decision makers what is and what isn't working. I'd now like to hand over to our Deputy Chief Executive, Judith Sharp, for the financial review. Judith.
Thank you, Patrick. The Healthwatch Norfolk annual accounts for the year ending 31st of March 2025 have been independently examined by Julie Grimmer of Larkin Gowan LLP in accordance with Part 4 of the Charities Accounts and Reports Regulation 2008. This year's accounts show total income for the year was £832,618 compared to £742,613 in the previous year, which is an increase of £90,005 on the previous year. Total expenditure was £735,699, which is a reduction of £13,663 from the previous year. The resulting net movement in funds for the year was a surplus of £95,340, which has helped to replenish reserves from the deficit there was 2 years ago of £83,857. And there was therefore an end-of-year balance sheet showing total funds of £421,304. Just over half, in fact 54%, of our income is funded by specific commissions of project consultation and evaluation work, and we would like to thank all the organisations that commissioned us to do work, as well as Norfolk County Council for their continued support. The statutory funding we receive, whilst welcome and important, does not enable us to do all the work we would wish in order to make sure the views of the people are heard by the decision makers within the Norfolk and Waveney Integrated Care Service. We will continue both our statutory work and also our commissioned work to ensure the voice of the public is brought forward and has a positive impact on the health and care services in Norfolk and the well-being of the communities we serve. Full copies of the accounts are available on request and will shortly be published with both the Charity Commission and Companies House. I will now hand over to Alex Stewart, our Chief Executive, for his review of the year. Alex.
Thanks, Judith. So Patrick's already alluded to some of the work that we've done over the last 12 months, and shortly we'll be showing a video that will be giving a good flavour of what's been going on. So I'm just going to highlight a few things. So the walk-in centre is one of the examples. One of our key aims, as you all know, is to make sure that everyone has the chance to share their views. A great example of this was during the engagement around the Norwich Walk-in Centre and the vulnerable adult service, along with the GP out-of-hours service. For those using the vulnerable adult service, for example, filling in an online form is not always the easiest thing to do. They also need to feel that their views are being listened to and a rapport being built up, so our team spent a week working with staff, and those that they look after at hostels, as well as other support services, to make sure we could hear exactly what their views were. As one person told our team, "I would not be here without them," a strong demonstration of the view of the service that's been provided. Carers of people with serious mental illness is another area we've been working on. Amplifying views has also been key when it comes to carers of those with mental illness. Work's already being done to ensure they are kept up to date and consulted about how they care for those that are looked after. And they've had input into a new carers contract and charter, which is being unveiled this autumn and will set out how they should be treated. Other communities we have worked with included those in North Norfolk who could share their views on the future of Benjamin Court, young people, and Norfolk's care home network, as Patrick has already outlined, as well as Norfolk's Polish community. With regard to one particular project which looked at safeguarding issues around adults with learning disabilities, we've taken a report to senior staff at the County Council, the Integrated Care Board, Norfolk Police, and it's influencing the concerns that are being demonstrated by those who really need to be looked after. One of the key issues that we are concerned about, obviously, is our future, and the future of Healthwatch Norfolk remains unclear. The government has announced that the functions of Healthwatch England and local Healthwatch, like us, should be absorbed into local authorities and integrated care boards. This is part of a policy shake-up that will also affect hundreds of other organisations responsible for overseeing and running parts of the NHS. We're waiting to see how this affects us, as are the County Council, directors of adult social care, the integrated care boards, acute and community trusts, and we will be keeping a close brief on this over the months and weeks ahead. Meanwhile, we will continue to work with communities across Norfolk and our partners across the health and social care system. We're now going to sort of move into the video, and this will show the levels of engagement and requests for help we receive remains high, and we're using that data to help support and guide our working priorities for the next 12 months.
There are so many pieces to the health and social care jigsaw that it can be difficult to see how it all matches and overlaps. But it is possible to put the pieces together and share people's health and social care views with those designing the service they need. And that's what Healthwatch Norfolk works hard to do. In the past year, we've gathered almost 5,300 pieces of feedback experiences through talking to people face to face, answering their inquiries on the phone, and collating the feedback we receive online through our website. Our engagement team's also written and compiled over 40 reports based on the feedback we receive from visits to GP surgeries, care homes and health and community events. We also received 197 requests for advice in the financial year, and this has meant we've received feedback like this.
It also helps inform our future priorities around the more detailed work to look into. One example of this is the ongoing concerns about access to NHS dental care. We carried out a survey to find out more, receiving over 200 responses. Over 3/4 told us they couldn't get a non-emergency dental appointment, and 48% couldn't get emergency care. People told us their practices had switched to private care, and they had in some cases decided to treat themselves. We recommended better signposting, children and the most vulnerable should be prioritised for care, and this led to our dental summit, where those in charge of dental services in Norfolk, dentists themselves, and the views of patients were debated. We heard some work had been started with more emergency appointments, more dentists employed, and a lot of prevention work going on to educate particularly children, but there's still a lot to do. We also asked Norfolk's LGBTQIA+ community whether they felt their healthcare was affected because of how they identified. A total of 164 people shared their thoughts, with nearly 60% feeling this was a factor. A lot of negative feedback was shared with us, particularly around consideration of sexuality and gender, and it's an area we'll be returning to. NHS Norfolk and Waveney also asked us to find out what the community wanted to happen with one of the buildings at the Benjamin Court complex in Cromer, which has been used for a number of services in the past, including reablement and rehabilitation. Nearly 300 people responded, mainly from North Norfolk, with 79% asking for it to be reopened as it was, while the remaining 21% wanted it to have a use relating to health and care. We were also asked to carry out detailed project work for a number of other organisations. We were asked to continue assessing the work being done to transform community mental health. We found many adults affected by mental illness and their carers are still not getting the help they should, with ongoing concerns about waiting times for help and people just not feeling in control of their care. It wasn't all negative. There was also some positive feedback about rehab, where different organisations and departments have been working together to help those who need it. The needs of carers were also front and centre of another report, this one focusing on those caring for adults with serious mental illness, or an SMI. It was a similar picture there, with just under half of those we spoke to concerned they don't get enough information and their voice isn't heard, as well as not getting enough help with their own health and well-being. There was also a focus on digital ways of getting care, with around 800 people taking part in a year of activity around developing those. We heard there were huge gaps in knowledge and awareness of things like the shared care record, which gives health and care professionals access to information so you don't have to repeat yourself, and also the NHS app. In fact, only around 20% of young people we spoke to said they were using it. We suggested more promotion and information about the app and other digital methods of getting help, and that's a key part of our work in the current financial year. Our engagement team have been really busy too. As well as their engagement work and compiling reports, they've also targeted care homes and visited a number to talk to residents, their families and staff to understand their experiences and also to share good practice. They've also ensured a Healthwatch Norfolk presence at the Crucial Crew events held around the county for Year 6 pupils. They've delivered workshops to over 4,000 children so far and also gathered their feedback around health and care. And across the year, they've carried out more than 260 face-to-face engagement visits talking to people and gathering their views too.
Healthwatch Norfolk's also been supporting the set-up and initial running of a youth council at the Queen Elizabeth Hospital in Kings Lynn. This aims to give those aged 16 to 25 a voice within the hospital around the issues that are important to them, and also help to shape the new hospital building and its services which are planned for West Norfolk. The first members are in place, with more to be added in the months ahead. The work doesn't stop there. Our projects around digital access to care and the experiences of carers of those with serious mental illness or SMI will continue. We also recently published a report around what patients thought was needed at the Community Diagnostics Centre at the James Paget University Hospital in Galston. This has already resulted in some changes, including improved signing and the introduction of a volunteer scheme to help people navigate their way around the building.
Meanwhile, project work continues around the Maternity Voices partnerships in Norfolk, the experiences of those who are deaf or hard of hearing at their GP practice, and mail fails, that's badly worded or explained letters or emails from health and care providers. Over the next 12 months, we also plan to revamp our online feedback centre to make it simpler and easier for people to share their experiences with us. And we're also bringing in a new service which makes it easier for people to leave feedback using BSL or British Sign Language. So a wide range of work and projects, but all playing a part in ensuring we can tell those making key decisions about health and care what's important and helping to put more pieces of that jigsaw puzzle of support together.
So what comes next, I hear you say? Well, we've reapplied to get our tender from Norfolk County Council, and I'm pleased to be able to say that we'll be able to announce the results on the 8th of August. And hopefully we'll be able to continue to work representing the views of our communities when it comes to health and social care. The group model obviously is going to bring with it a number of changes structurally as well as many challenges, and it's important that we have a patient voice and ensure that representation continues within this process. We have an application currently in to do some work across the acute hospitals to ensure that this happens. So our work, for example, around digital methods of accessing care for the ICB is also going to continue, and we will continue to find ways to help all our communities to use the current and future technical methods of seeking help and treatment. And of course, lastly but not least, our work with SMI carers and social services support for those aged 65 plus continues too, along with strong programme of engagement with communities across the length and breadth of Norfolk. I'd also like just to take this opportunity to thank board members for their continued support and for the help that we were provided with in putting together the tender bid that we submitted to Norfolk County Council. I'll now pass back to Patrick to conclude the business of the AGM.
Thank you very much. Thank you, Alex. We now need to ask for questions. We publicised on our website, online and through our newsletter, asking people to submit any questions. And we will always endeavour to answer those now, but if we can't, they'll be answered publicly on our website within 14 days. So the big question is, do we have any submitted questions?
We did have one, but it wasn't about us. It was a question to do with the operation of the walk-in centre. So if you're happy, I'll forward that across to them to answer.
Okay. Thank you very much indeed. So finally, do we have any other business around the room? No? Thank you very much. So I would just like to echo Alex's thanks and say a big thank you to everyone who's contributed to our work over the past year. My colleagues on the Board of Trustees, the staff, the volunteers and everyone in Norfolk who's taken the time and trouble to share their views with us. I'd now like to formally close the AGM by sharing a video which sets out one of the most high-profile pieces of work of the last 12 months. Proposals to alter services at the Norwich Walk-in Centre, the GP out-of-hours service and the Vulnerable Adults Service created great concern. Changes to some or all of these services caused enormous worries when it has been suggested in the past, and this time was no exception. Although the ICB halted the engagement, opting to keep things as they are for the time being, we continued to gather some strong feedback around their value, as you can see in this video, which closes our 2025 AGM. Thank you very much for attending.
3 lifeline services keeping people healthy, which could also prevent them needing time in A&E, must stay. That's the key theme of a new report by Healthwatch Norfolk, based on hundreds of survey responses. Healthwatch Norfolk was asked to analyse and report back on plans for the future of the Norwich Walk-in Centre, the Vulnerable Adults Health Inclusion Hub, which offers GP support to people with no fixed abode, and the GP out-of-hours service. Although health bosses decided not to progress with any changes midway through the consultation, we continued with the survey to demonstrate people's views of the services they're being asked about. A total of 2,100 people sent in completed responses through face-to-face consultation and online surveys, and formal responses were also received from a number of different organisations. Healthwatch Norfolk also conducted face-to-face sessions with adults in vulnerable situations and the staff who care for them to get specific information about use of the Vulnerable Adults Service. People leaving feedback all raised concerns about the impact of the service changes. They said reducing the GP out-of-hours service would make it difficult for those to get help, particularly affecting people in rural areas, older adults, disabled people, and those with no access to public transport. This would divert more people to A&E or emergency services, increasing pressure there. There was similar feedback around the Norwich Walk-in Centre. People told Healthwatch Norfolk it provided vital same-day care for those who couldn't get an appointment from their GP. They also feared proposals to reduce operating hours or close the centre would limit access to care, increase waiting times, put more pressure on hospital emergency departments, and were also sceptical if any cash savings being diverted to GP practices would actually mean more available appointments. Meanwhile, the Vulnerable Adults Health Inclusion Hub was seen as a lifeline, literally in some cases, for people who are homeless, isolated or have complex health needs. Most felt it should stay where it is, rather than moving to a mobile service as people know where to go. It provides consistency, and patients would struggle to find it if it was moving around. Many of those taking part in the survey, which was designed by NHS Norfolk and Waveney, also found it difficult to complete, with respondents leaving the questionnaires unfinished due to the repetitive nature of the questions and confusion caused by their wording. As a result, around half the people who started the surveys failed to leave full responses.
I think the thing that stood out the most for me, and we heard repeatedly throughout the conversations that we had, were that the people that were using this service had tried to engage with healthcare in different settings previously and had just been unsuccessful, which had led to some of them having long periods going without adequate healthcare. But however, since engaging with VAS, they were having their health needs met and were able to access care in a timely manner with people that they trusted in a familiar location. And many of them said to us that they just would not be having their health needs looked at or seen to or monitored had they not been able to access VAS. And I think as well, something that the staff mentioned to us, which was important, was that the presentation of some of the people who use VAS could be, is complex. A lot have complex health needs, and in a different GP setting, for example, where the appointment times are shorter, there is the risk that some of the underlying issues, such as perhaps an undiagnosed learning disability or different acquired brain injuries, for example, may be missed and may be seen as their symptoms may be allocated to some other condition. So, with VAS being able to offer longer sessions and having already built that trust with their clients, they're able to fully address all of the complex health issues which perhaps other clinicians may not have had time to do so. Yeah, I mean, I think, it's quite confronting to have the label of vulnerable being attached to yourselves. Many of the clients and the staff just saw it as a specialist GP surgery, and that was, the branding and the image that would be far more fitting. It was felt that the vulnerable wording was perhaps quite off-putting to some. They may not class themselves as vulnerable and then miss out on the opportunity to access that service. It's quite stigmatising when they're having to fill in paperwork for, say, housing applications or even job applications, to have that name to be labelled as a vulnerable adult and have that as your GP practice name is a bit belittling. I think the imagery that was used alongside the title was problematic for some of the service users and the staff. The imagery of chains, it's not very progressive. It's not really expressing the positive aspects of the support that takes place. And it could be particularly difficult for those who are perhaps asylum seekers or prison leavers who have different connotations perhaps attached to an image such as chains.
Following a full analysis of the feedback, we made the following recommendations. Maintain the current number of locations for the GP out-of-hours service. Maintain the current Norwich walk-in centre. Keep the current vulnerable adult service health inclusion hub in Norwich. Consider renaming the vulnerable adult service as people felt it didn't reflect what the organisation did, and produce a new logo which doesn't include chains, as these can put both former prisoners and asylum seekers off seeking help. And improve the way surveys are designed and responses are collected in the future.
It was very difficult for patients to understand, and I think rather confusing. They weren't provided with any options per se, and it was jumbled together. So if you were somebody with special needs, for example, who made use of the vulnerable adult service, it was unclear as to whether or not you were answering it as a vulnerable adult or perhaps as a person who was just using the walk-in centre as and when they required to. Yes, and the ICB to a degree did listen and changed the survey, but I don't think they changed it well enough, and I think that led to an awful lot of confusion. And as you know, we had probably about 4,500 responses, I think, towards the end, but about 2,000 of those weren't completed because people just got so frustrated and confused and made reference to that in the comments when they were forwarding it back to us. I think as an organisation, Healthwatch really came to the fore, and we were able to sort of not only add to our engagement events, but we were able to ensure that the engagement officers were fully briefed to talk to people about the potential of the walk-in centre closing. That was incredibly important because people are sometimes marginalised for whatever reason. They don't necessarily feel comfortable answering the surveys because there's a suspicion as to what might happen with it. And it's being able to sit down and explain face to face with somebody about what the potential options could be moving forwards. We discovered a whole host of things. For example, the logo being used for the vulnerable adult service was something that they kind of felt suggested that people were manacled or in some form of chains. And rather than it really expressing what the service does, which is absolutely amazing.
You can read more and download the full report here.